I'm John Granquist, and I'm going to talk today about stress testing. Now, why do we do stress testing? It's a very common cardiology test. Typically, we do it when we're trying to figure out if somebody's symptoms may be related to a severe narrowing in one of the heart arteries, which is cutting off blood flow to the heart muscle, otherwise known as coronary artery disease. The way we do a stress test is usually we have people exercise, and that involves walking on a treadmill while you're hooked up to a continuous EKG, which is monitoring the heart, and your vital signs, including your blood pressure and your heart rate, are being monitored closely. The test is always supervised by a cardiologist and performed by a special cardiac technician. Now, with stress test, people often ask, how long do we go on the stress test? How hard is it going to be? And it's different for everybody. We usually start very slowly, and every few minutes the treadmill gets a little bit faster and a little bit steeper, with the goal to get you to a certain heart rate so we can get the best information about the heart. While you're exercising, we're monitoring you for symptoms, and we are looking for certain changes on the EKG that may suggest that blood flow to the heart is being compromised under stress. Now, in addition to the regular stress test, which I described there, your cardiologist may recommend additional imaging after or during while you were exercising. Sometimes that involves an ultrasound of the heart, which is called a stress echocardiogram, where echocardiogram refers to the ultrasound. Or we do what is called a nuclear stress test, where we give you an injection of a radioactive chemical through an IV, and we take pictures of that chemical into the heart, which helps us see blood flow in greater detail than a regular treadmill stress test. Now, the next question that often comes up is there are some people who are unable to exercise on a treadmill, either for arthritis or orthopedic limitations, and can those people have a stress test? And the answer is yes. We do a special kind of stress test called a pharmacologic stress test, where what we do is we give you a medicine through an IV, which helps to dilate the blood vessels in the heart and all over your body, just like when you exercise. And we take pictures of the chemical, usually again with nuclear imaging, which gives us complementary information about how blood is flowing in the heart for people who are unable to exercise.